Hi, everyone. I see people are filling in. So we're going to give folks just a minute or two to join us to get online. Hello to everyone who is joining us. We are so excited to get started to talk with you today. I just want to remind folks that the chat is open, so we hope that you will engage with us there. We invite you to introduce yourself, let us know where you're joining us from. You can send any questions that you have using the Q&A feature. We'll be pulling from there to answer questions throughout and after our panel. And I see some folks are still joining in. All right. Thank you all so much again for joining us. I just want to say again that the chat is open, so we hope that you will engage with us there. We invite you to introduce yourself, let us know where you're joining us from. It's exciting to see everybody popping in. Please send any questions that you have using the Q&A feature. We will be pulling from there to answer questions throughout and after our panel. All right, we are going to go ahead and get started. Excited to see everyone introducing themselves. It's so nice to see you all. My name is Liv. I am the U.S. Program Coordinator. I use she, they pronouns. And in my role, I have the opportunity to support the development and the implementation of our new U.S. Fellowship. So I'm really excited to talk with you all about that today. I am based out of Massachusetts, and I'm going to turn it over to my colleague, Ariel.
Hi, everyone. I'm Dr. Ariel Arguelles. I am the U.S. Community Alumni Senior Coordinator, so working for the U.S. program in conjunction with our Community Impact team and with Liv and John. I am based out of Houston, Texas, and I'm very happy to be here. I'm going to pass it on to John.
Thanks. Welcome, everybody. Oh, man, I see a lot of folks from all over the states. It's really exciting to have you here. My name is John Cape. I am the Chief Program Officer at Global Health Corps. I've been here for 7 years, and I couldn't be more excited to help launch this incredible program for emerging public health leaders in the U.S. So we are excited to have you all join us today to hear about our program and to meet some of our alumni. I'm going to turn it back over to Liv.
Thank you both. So we're going to jump in just to help orient everyone to how we're going to spend our time together. We're going to do a brief presentation of the U.S. Fellowship and talk a bit about how it's structured. And then we have some program alums joining us, and we'll do a panel of them to hear more about their experience. And then we will be taking questions from the room to see what else you all want to learn about. So we're going to jump in. So at Global Health Corps, we envision a world where every person is living a dignified, healthy life. Our team and our community is united by the belief that health is a human right. And given that, our mission is to mobilize a diverse community of leaders to build the movement for global health equity. So I will share a bit more about how we're doing that. Many folks on this call might be familiar with our Africa Fellowship. Through this program, Global Health Corps recruits, places, and trains young professionals from 13 countries across sub-Saharan Africa to serve in high-impact global health roles in Malawi, Rwanda, Uganda, and Zambia. And this year, our team is also launching a U.S. fellowship program. So this program has been developed in alignment with our mission, our vision, and our values for achieving global health equity. And we have designed this program with some differences compared to our traditional fellowships. So I'm really excited that we have some time now to share more about how this program will function. So with workers burnt out from the pandemic and many nearing retirement age, there will likely be, we expect, an exodus of leaders during the next 5 years. Recent studies have shown that 44% of U.S. public health workers are considering leaving their job due to burnout. Meanwhile, the sector has been chronically understaffed and is struggling to provide basic public health services. And these deficiencies disproportionately impact people who are Black, Indigenous, and others who identify as part of the global majority, leading to really staggering health inequities. So the GHC Fellowship in the US will really work to identify diverse, high potential emerging public health leaders who are already working in the field and provide them with the leadership, training, coaching, network, and resources to excel in their careers and advance health equity. And we do believe that this program is really going to be able to meet an urgent need. So with our US fellowship, we are centering emerging leaders who are already employed in a non-clinical public health role. And we believe that this opportunity will strengthen fellows' leadership and management skills. It will expand their networks, improve their understanding of systems change, and also increase their capacity for impact. We really want to invest in emerging leaders who want to advance their public health careers in pursuit of global health equity. And the applications for our program are open now. So if you are interested in applying, which I hope you are if you're here, I want to make sure that you understand the eligibility requirements for this program. So to clarify, to be considered for this fellowship, you must be an emerging leader, and we define that as being between ages 21 to 30, currently living and authorized to work in the US, currently employed in a United States-focused non-clinical public health role, and employed at your current organization for at least 6 months at the time of your application. So our team has incorporated an eligibility quiz also to help you consider if you meet all of the eligibility requirements for this program. This can be found by scanning the QR code or by visiting our website. And if you have any questions about your eligibility, you can also reach out to me at usfellowship@ghcore.org. So please keep in mind that the applications are open until March 24th, and those who are looking for priority consideration should plan to apply by February 24th. We'll be reviewing all applications submitted by the priority deadline, so any application that's received after that point is going to be reviewed on a rolling basis. And our US fellowship also uses a separate application portal, so please make sure that you're on the right page when you're creating your account. We encourage you to start your application as soon as you can. You can always save your progress throughout. And it's also important to note that to have a complete application, you will need to have a reference submitted by your current supervisor. And we're not going to be reviewing any applications until we receive that reference. So making sure that you get your references in under the same deadlines listed on the screen will be really important for your application process. So we encourage you to visit our website if you have the time so that you can get a full understanding of the time commitment for the project. All of the fellows in this program will engage in monthly virtual workshops, small group learning, a 360 assessment, executive coaching, 2 in-person convenings, as well as independent learning through reading, writing, and reflection. And there will also be an opportunity for continued learning and leadership development through a professional development grant. At the completion of the fellowship, fellows will be integrated into GHC's lifelong global network, which includes over 1,000+ alumni spanning over 40+ countries. And all participants also receive coaching and support throughout the fellowship and beyond from our staff. So one of our alumni, Jessica, has shared a testimony with us about her experience, and she has said that this fellowship changed my life. It made me a stronger leader. It made me learn hard lessons about the world, its systems, and myself. And it allowed me the opportunity to work alongside people from so many different cultures and backgrounds to really make a difference in the pursuit of health equity. So with that being said, I'm going to turn it over to John to introduce our alumni panel so you can hear directly from other folks who have participated in our programming about their experiences. So thank you all so much for listening. I'm already seeing questions coming in through the Q&A feature, so please keep sending them. We'll be pulling from there for more questions. And over to you, John.
Thanks, Liv. Yes, please continue to pop your questions in the Q&A. Liv will answer some of those. We'll take some time at the end for any Q&As that are helpful for us to explain. They can be questions both to our alumni panelists, but also about the program. I am excited to have 3 of our alumni who are, again, part of our community of 1,200 around the world. We have over 400 alumni based here in the US. Lanice, Samir, and Estefania come from different years, or they're doing some kind of incredible work in global health. So we're going to take a few minutes just to allow them to introduce themselves. And then I'll have some questions so you can learn a little bit more about what the benefits are of joining the GHC community. So I'm going to go in order of the folks who've most recently kind of entered our community. Samir, I'm going to pop over to you. I'd love for you just to tell us a little bit about your journey and what you're doing now.
Yeah, so hi everyone, my name is Samir Kalarn. I currently reside in Brooklyn, New York, which is also where I had my fellowship 5 years ago. Through my fellowship, I worked for a community-based organization called Housing Works, where I worked as a population health fellow. I got to do some incredible things with the organization. They're deeply rooted here in New York, been around for 30 years. So it was just a fantastic experience being there. I'm originally from Phoenix, Arizona, and have a background in data analytics, which is what took me to Global Health Corps and to New York. And now I work as a healthcare consultant for federally qualified health centers, community health centers, community-based organizations, helping them to be successful in new alternative payment models that support health equity. So that's just a bit about myself, and yeah, it's pretty crazy just thinking about the last 5.5 years and how really GHC brought me here. Thanks for having me.
Thanks, Samir. Lanice, we're going to go over to you. So again, tell us just a little bit about your journey and what you're doing now.
Hi, everyone. Good morning, good afternoon, or good evening, depending on where you are. I'm Lanice Williams. I was in the fellowship class of 2016 to 2017. I was based in Washington, D.C. That's where I currently reside and work as well. I worked at Global Health Council as a policy associate. What I really enjoyed about that position is I got exposed to all global health issue areas, particularly a lot of my work focused on engaging with members of Congress as well as the executive branch. So, for example, the Office on Management and Budget, which is how all money is, they work. Congress appropriate funds to various global health programs. I was able to engage with Congress, really advocate for different legislative bills, particularly making sure those legislations that are passed through Congress and signed in law by the president did not exacerbate harm, but also thinking about ways we can also work with partners in the US as well as in other countries to ensure that we're achieving equity as it relates to global health, from HIV, TB, malaria, all the way to the sustainable development goals. Post my GHC fellowship, I actually started working at Friends of the Global Fight Against AIDS, TB, and Malaria as an advocacy and partnerships manager. Got to know staff there actually through my GHC fellowship, which is what actually also helped leverage me getting that opportunity. And through that opportunity, we work closely with the Global Fund to Fight AIDS, TB, and Malaria to do a lot of advocacy around continued US support for the Global Fund, but also through the other US bilateral programs. So the President's Emergency Plan for AIDS Relief, as well as the President's Malaria Initiative, as well as USAID's tuberculosis program, but also really enjoyed getting the opportunity to work again with different partners, particularly taking a multi-stakeholder approach, working with faith-based communities, working with the private sector, of course, Congress, the executive branch, as well as civil society on moving the needle as it relates to not only continue funding, but ending the 3 deadly infectious diseases. Post my fellowship and my time at Friends, I've done a variety of different work. I was doing some gender integration work, but currently right now I work as a senior program officer at JPIGO, which is headquartered in Baltimore, Maryland, where I work on a global project called Mosaic, which stands for Maximizing Options to Advance Informed Choice for HIV Prevention. Particularly, we work closely with adolescent girls and young women, as well as other women. That also includes transgender women, as well as pregnant and breastfeeding population, around ensuring that they have information to make choices around HIV prevention through the biomedical interventions, which would be oral pre-exposure prophylaxis, cabotegravir, which is the new injectable form of PrEP, as well as the Deprivering PrEP vaginal ring. So it's been about almost 6 years. It'll be 6 years in August of this year since I've completed my fellowship. It has been a great opportunity of tremendous growth. I've been able to engage not only with different people I've worked with, but also formed lifelong relationships with 2 of the other people in my cohort, been able to work closely with other people that are here on this call as well with the alumni. So I would say if you're considering GHC, it's definitely a great opportunity for you to consider, but also how to continue to fight around health equity as well.
Thanks, Lenise. Stephanie, we'll go over to you.
Thank you. Hello, everyone, and welcome to this session. I hope it's helpful and inspiring, and you decide to participate in this wonderful program. And so my name is Estefania Palomino. I'm a director at the Aspen Institute with the Aspen Global Innovators Group, or AGI. AGI is a group that is devoted to decolonizing global health and development. And we do so through impactful fellowships and leadership programs. We work with leaders, underrepresented, underserved, who are brilliant and have amazing solutions that we can bring to scale in multiple countries. So we have a set of programs that are focused on sub-Saharan Africa, other global programs that have a reach in Asia, Latin America, and the Caribbean, sub-Saharan Africa, and the US, and we have programming also here in the United States. And so I had a wonderful experience with Global Health Corps, and I think it's been crucial. Maybe we can go into more detail later about how that led to my current position, but I think it was a wonderful experience that really prepared me for the work that I'm currently doing. So as part of the Aspen Institute, I am working with a lot of folks that I interacted with during my fellowship year and beyond, and the ecosystem that we're trying to build, and not only for our team and our program, but also for the people that we serve. It's an ecosystem that was formed due to Global Health Course Fellowship. It's kind of part of all of that impactful connection. So it was really an amazing program, highly recommended. And again, nowadays, I feel like I can reach out to any a person working in global health in different, you know how this field could be a little bit siloed, unfortunately. And so I feel like I can definitely find those connections, independent of geography, independent of topic that we're dealing with, of fellowship year, is part of being a member of this community.
It's just really exciting to have such accomplished folks as part of our community, but especially knowing the journeys you've taken to get to where you are. Samir, I'm going to go over to you for our first question. I'd love just to hear a little bit more about kind of where you were in your career when you joined the fellowship, and what was most compelling to you about joining GHC and becoming part of this community?
Yeah, so when I first got the fellowship, or right before that, I had a few years of experience working at a clinic in Dallas, Texas. And the main thing that really drew me to Global Health Corps and trying to join a community like this was that I felt very siloed in the work I was doing. And I was always craving perspective. I still crave more perspective, since the work we do is completely intersectional. You cannot impact one thing without impacting something else or considering more than one thing at a time. So that's what originally drew me to Global Health Corps. It's the reason why I applied, and it's the main thing that I've taken away from the Global Health Corps experience was gaining perspective from people brought together from all parts of the world. It's items that I still use, it's tools that I still use to this very day in my work, is how do I approach certain situations? Since I come from an analytics background, how do I actually pair that with real world perspective to make an impact and to help others make an impact as well? So yeah, I think that the big thing that I was really craving before I joined Global Health Corps was perspective, and to have a more broad sense of what was happening, and that's what I got from Global Health Corps.
Thanks, Samir. I'm gonna have a follow-up question for you, but I can kind of, as we're going through Q&A, folks, I'll just add some information about the fellowship that I think will be helpful for everybody watching. So even though our fellows for the US fellowship will all be kind of living and working in the US, we will be connecting with our Africa-based fellows. So continuing to really reinforce that sharing and that global perspective sharing. And certainly we have quite a diverse country. And so we're bringing folks from all across the states who are in different kind of areas of work, who have different social identities to be together in this learning space. So Samir, I want to kick it back to you. Tell me a little bit about like why that breadth of perspective has been so important, and how has that really helped you to increase your impact as a public health professional?
Yeah, so I think the main thing about this is that I don't think you could effectively work in public health without a broad perspective. I don't think when you're trying to push data, we could gather all the data we want, we could publish as many reports as we want, but when it comes to creating things that are actionable and things that actually work on the ground level, there's no way to do that without applying perspective from the communities that you're serving. And I was able to gain tools to do that effectively through the people I met in the fellowship program, and people who are my best friends today living here in Brooklyn that I see all the time. It's something that I don't think I would be where I'm at without this perspective. And if anything, what it's taught me to do is to ask even more questions and to link myself with people with experiences that I've never encountered before. So yeah, I think that I don't think I'm able to do my work in appropriately applying data to our healthcare system without perspective.
Stephanie, I'm curious to hear a little bit more about some of your experience with GHC. You were kind of implying that there were either some of the skills or some of the relationships that you've built through GHC or the community have been really helpful in leveraging you to kind of where you are today in your career. So can you talk just a little bit about either the skills or the relationships, again, from the GHC ecosystem that have been most instrumental for you?
Absolutely. I think both aspects are crucial in the fellowship experience. So in terms of the skills, you get to work with wonderful people at very impactful organizations, people that I think you probably admire as part of your career and your journey. And so being mentored by these amazing leaders, having access to these organizations, I think that was really valuable. In my case, I was placed at Planned Parenthood, and that really changed my life. It was an experience not only so valuable from a professional standpoint, but also from a personal standpoint, being a women's rights advocate, an immigrant, passionate about reproductive justice, just being able to meet all of these wonderful feminist leaders in the US and globally, that really meant a lot to me. And that taught me a lot on how to work sustainably in this space, because we all want to we all want to work really hard in this mission, but we want to also do it sustainably and responsibly and take care of our mental health. So having all of these access to all of these good practices was crucial. And then in terms of the connections, to this day, I work with people that I met during my fellowship year or as part of the fellowship experience. I have supported organizations that are within the GHC ecosystem, organizations that and people that are part of the ecosystem have supported me in different stages of my career. So it's really impactful, and it really creates a community that you can lean on, and that also you can get back to at different points of your career.
The power of the network, Stephanie, I think is one of the things that I find so valuable as well. I always appreciate when people talk about your net worth is your network. I'm curious to hear a little bit, just because of the role you have, how you run into other GHC folks, whether people you've met before, or not, and how you kind of like what that relationship is like when you realize you're with another GHC alum. And just to kind of share, right, the within our we are represented, GHC alumni are represented at over 200 organizations around the globe. And so it is quite frequent that we are running into each other in all of these spaces. And part of getting to join a community like this is getting that sort of access and that connectivity. So Stephanie, I'd love to hear any of your experiences or kind of what that is like when those occurrences happen.
Yeah, we say once a fellow, always a fellow. And it truly is a very authentic statement, because every time that you interact with someone who's part of the community, has been part of the community, there's this sense of belonging and transparency and all of the values that come with being a GHC fellow and alumni. So I think it's something that happens to me often. Thankfully, it happens to me more and more because the community keeps growing, which is great. And I joined, I think, in the early-ish years of the fellowship, and now I find that there's so many people doing so many interesting types of work out there that are part of the GHC. So that is always a positive experience for me. And again, it's also about, this fellowship is also about being a fit in terms of values, right? So when we're all centered around the same values of equity and global health, trying to promote right to health, to defend right to health, I think we come from that understanding, and it's much easier to work together in whatever it is that you're pursuing in the future.
Thanks, Stephanie. We talk a lot about the fellowship program. I want to talk about the alumni program a little bit as well. So Lenise, I'm going to head to you in a second. But our fellowship program obviously has just a ton of opportunities and benefits, right? It includes, and for the US Fellowship, monthly opportunities to come together where we'll be doing leadership skills building. We'll be talking to global health practitioners. We'll be meeting in small groups to learn from each other. It includes a $1,000 professional development fund that folks can kind of leverage for their learning outside of the GHC space. It includes free executive coaching and the 360 evaluation to really create kind of that understanding of the impact you're having in your organization, and then just a wealth of resources. And of course, we're going to be coming together twice in person to be able to really get to build those relationships and learn together in person. But that's just a year, and now all of you have been alumni more years than you ever were a fellow, and we have kind of a career-long investment in the folks who are part of our community. Lenise, I know you have really taken advantage of a lot of those opportunities as an alum. I'd love to hear just a little bit of what being an alum has been like for you, and what some of those benefits have been as being part of a community that lasts much longer than just a fellowship year.
Yeah, so I think Stephanie hit on it once. A fellow, always a fellow. So although I've been in the alumni community for almost 6 years, I still almost feel like I'm a fellow. I would say different opportunities like I've taken advantage of is I really do value mentorship and sponsorship. And if there's a way that I can mentor and or sponsor fellows within the GHC community as they transition to become alums, that's something that I'm very big on. There's a lot of people that I've served as community mentors for that I'm still like, we've became friends, but it's also, we still have a very mentor-like relationship, but I've also been able to either submit recommendations or be a sponsor for them, whether it's some type of professional development opportunity or whether it's work or something that they just want to further their skills. I would say other things that I've taken advantage of as an alumni, GHC really provide great different programs for alumni. A lot of those are, for example, some are in partnership with McKinsey & Company, which has been pretty pivotal. For example, I was one of the fellows that was accepted to the McKinsey Black Leadership Academy, which I think for me has really helped define my skills as a leader. Even in the current work that I'm doing currently on my project, I serve on the management team and the primary interface with, we're a subcontractor to another organization. I'm a primary interface with them, but also making leadership decisions with my team as different things arise as it relates to what could potentially impact different aspects of the work that we're doing, but also looking at things that could further enhance my skills, whether that's around communications, whether it's crisis communications or just day-to-day communications, also how to think about things differently. A lot of my work, I take a holistic as well as the intersectional lens to everything that I do. I know, as Estefania mentioned, global health is very siloed. Health is one thing, family planning and SRHR is another thing, and everything is separate, but we need to more so look at a person from a holistic perspective. Health is the foundation of everything for how they access education, economic opportunities, and so forth. So I would say those are some of the things. I also really appreciate getting to meet different other alumni in the community as well. Some of them have been like sounding boards for me. I think as Estefania mentioned, like you're still interacting even as an alumni with many people that you might have worked with as a GHC fellow, or you encounter other alumni as well.
Thanks, Lenise. I'm going to ask some questions to kind of all of you, and invite any of you who are feeling inspired to answer just to go ahead and come off mute and share your response. So my first question is, if there are any particular anecdotes you can share with us from the fellowship experience, or from being an alumni. So like, let's expand it, not just from that year, but they could be, and I'm looking for kind of anecdotes that have really had an impact on your leadership, either as a personally or as a professional. It could be a new concept you learned. It could be a conversation you had. It could be an experience you had, again, from the fellowship or kind of as an alumni. So any anecdotes that you can share with us that just have really stuck with you as part of your leadership learning?
Well, I first would love to say that, I just made wonderful friends as part of the fellowship and alumni experience, and that, they're part of my family. And as I mentioned, I migrated to this country, so I didn't have that much of a support network, and personally, GHC was able to provide that by connecting me with all of these wonderful people who I consider family, many of them, right? So that was a very positive experience for me. And then the other thing, I participated as an Aspen Ideas Health Fellow because of my connection with GHC. So someone at GHC was kind enough to nominate me to speak at the Aspen Ideas Festival, which is this big platform that I'm now a part of. So I spoke at the festival, and I increased my visibility. Years down the road, I interviewed for this job, and I was able to say that I was already part of the Aspen Institute family because of that opportunity. So there's a lot of serendipity in the work that we do, a lot of connections between the organizations that we're a part of, and GHC is definitely able to provide that.
Thanks, Stephanie. And it's true, we are frequently asked to nominate folks for opportunities, and are always excited to leverage our community members to be able to do that. Samir or Lenise, either of you kind of feel inspired? Anything from kind of some anecdotes that you might want to share that have just really stuck with you?
Mine isn't necessarily a specific anecdote. For me, during COVID, especially the early days of COVID when everything shut down, it was a madhouse here in New York, and I was in overdrive at the clinic that I worked for, and one just very cool thing that I just kept seeing over and over, we're seeing all of the other GHC alumni that I knew from our fellowship year shifting gears and either continuing their work that they're already doing just in overdrive, or pivoting and doing what they could, being a leader still in the COVID area, but potentially in the space that they were an expert in, or shifting to something that they knew that they could just do in the here and now. So it was just very cool seeing our whole community kind of get through it together, and seeing that, like, yeah, we came out of the fellowship as leaders in the space, whether it was at the organizations we were working for or just in the community around us. It was just a very cool thing to see, and it's stuck with me, and I don't think I'll ever forget that.
Thanks, Samir. I think one of the things that makes GHC's program unique is the emphasis on leadership, right? It's not the technical approach. We do a lot of support around influence, right? Like how to become a stronger writer, how to leverage your voice, how to use that personal narrative. We're looking at how you are influencing the people around you, how you're managing teams, but we're also really looking at the individual, right? Including kind of mental health, and wellness. And so how are we taking care and pouring into ourselves so that we can pour into others? Again, I'm curious to hear from any of you what that approach to leadership development has been like. What has it been like to be part of a community that's not just looking at kind of the technical work, but really looking at leadership holistically?
Well, I could step in.
Go ahead, Samir. Yeah. And then
yeah,
I'm going to go over to Lenise because I saw her smile, so she's thinking something.
Oh, was she? Yeah. I think for me, it was sort of one and the same thing, especially going through the fellowship program. I think becoming a leader means understanding yourself better, and when you're able to prioritize yourself in your own health and mental health, you're able to become I guess a better person for others and the people around you on your teams, and just people who look to you for assistance or for guidance. So yeah, I mean, I think, what the fellowship helped me do was really understand who I was and how I'm able to use my full, real, authentic self in the work that I do. So
I would just say also to add on to that, I think as a leader, it's also definitely important to be comfortable showing up as your whole self. I think sometimes in environments, depending on the environment we go into, we're typically used to trying to show people who we think we want them to know. But I feel like in order to be a leader, you have to be your authentic self. We're not perfect, showing who you are. And it's also okay to know that you don't know everything, and that's why you have your colleagues who you can lean on, but also being open to learning. Being a leader, it's just not you reach you reach at a high level position, because I do believe you can also lead from whatever level you are. If you are in an entry level position or in a high level position, you should be able to lead from wherever you are. And I think Shamir kind of also hit on it, like you can't pour from an empty cup. We saw during the COVID pandemic, especially in the height, that a lot of people were burned out. We also seen this whole great resignation where people were leaving their jobs, trying to figure out and see where they want to be. So I also say it's also important to set aside time from yourself, if that means using your PTO to take time off work, having open, transparent conversations with your supervisor if you're feeling a bit burnt out, if you need extra support, knowing also how to say, no, I'm working on multiple things. I can't accommodate this additional task. Maybe we can figure out how to better delegate things out to others on your team as well. So helps a lot with that too.
Thanks, Lenice. Estefania, Samir, Lenice, thanks so much. I'm going to bring Liv back on real quick. We're going to kind of address some of the Q&A questions. Before we close out, I will come back around to each of you for kind of any last words that you want to share with the folks who've joined us today. I know, so Liv and I will kind of bounce back and forth a little bit. Liv's going to kind of help summarize some of the key questions in the chat. I do know there's a number of questions about eligibility, specifically about kind of the requirement for folks to be living in and authorized to work in the US. So the US fellowship is specifically for people living and working in the US. We do have our Africa Fellowship, which is in East and Southern Africa. Folks from 13 countries. This year, we opened applications to folks from 13 countries across Sub-Saharan Africa. Those applications have closed for this year, but that is an annual program. And so if you are living and working in East and Southern Africa, or really anywhere in Sub-Saharan Africa, because we will be potentially expanding recruitment for that again this next year, please do sign on to our newsletter, follow us on social media. You will have the opportunity to see when we're opening those applications. We would love to kind of get your applications. Anybody in our fellowship is joining our global community of alumni. We have different entry points to kind of how folks become part of GHC, but everybody who comes through our fellowship is part of the same community and has access to those same sorts of opportunities that Estefania, Samir, and Lenice are talking about. And we would love to have you join us. You might have a great network of folks who are living and working in the US and can share this opportunity specifically around the US fellowship with them. So we certainly invite you to do that. Liv, I'm going to turn over to you and help to talk a little bit about us. Maybe we should cover, as you're coming on, some of the other eligibility requirements. I know there's some age requirements as well. So our program is specifically geared towards folks who are 21 to 30 years of age at the beginning of the fellowship year. For this year, we're just kind of qualifying that as June 15th. So if you are 21 up to 30 years on June 15th of 2023, you are eligible to apply. A lot of our reason for kind of targeting that group is we are able to, we're not seeing as many opportunities there for kind of emerging leaders coming into global health. And we want to really be supporting people in kind of a career-long relationship. That's why we've targeted it for that. We've kind of some other great folks in our network who are targeting folks kind of beyond that age group. I know how disappointing it is if you're like, but I just missed the cutoff. So you can reach out to us. We're always happy to kind of highlight some of the other leadership programs that we're familiar with, who we would love to advertise, who are really looking to support leaders who are kind of moving into that aspect of their career. Liv, over to you. Any questions that you can highlight for us?
Absolutely. We got a ton of really great questions. And John, I think if you want to identify one of our panelists to kick us off for this first one, this question was, what is a highlight that you feel made you stand out as a participant in the program?
Great question. So for Samira, Stephanie, and Lenice, Also, I would bet some of that's also about the application. It's a bit of a different application than any of you filled out, but we are asking for kind of essay questions that are of the type you would probably anticipate from GHC in terms of what are you trying to work on? How are you trying to grow as a leader? What are your kind of strengths and things like that? So tell us a little bit about when you approached your application, either for this or other opportunities. What are some of the things that you've tried to highlight in your own experience or orientation to this work that you would recommend others do?
Yeah, I can go first. I think with my application, like when I applied, it was, of course, it was a little different than it is now. I think I used kind of a storytelling approach so that when the person was reading my application, they could get an understanding of my story, like what were my motivations, what motivated me to apply to GHC, but also I talked a little bit about what I feel like not only my current experience, but how can I contribute to the GHC community, the fields of kind of like global health, and kind of what I hope to achieve and how I continue to want to build upon that experience post fellowship. That's kind of like some of the things I highlighted in my essays. Of course, like they're reading your essays, so I would try to say whoever the reader is, you want them. It's not a lot of words, it's like 200 to 300 words, so you want to be as concise as possible, but you also want to make sure that person walks away having an idea of who you are, what are your values, what drives you, what's your passion, what do you want to gain from the experience, but also what can you contribute.
That's a killer answer. Take that. It will help you a ton, both with GHC, but honestly, any place that you're looking for an opportunity. Storytelling is a huge and important part of leadership. It's also a really important part of getting to show who you are. And that's certainly what we're looking for. We're looking for real people who are ready to join us. So thanks, Lenny. So that's great advice. Liv, do you have some other questions for us?
Yes, we do. John, this one I think would be great for you to answer. Someone is wondering, what role do our supervisors play in the process of the application, and what are some useful things that they could tell their supervisors about the program?
Perfect. So we require a reference from supervisors as part of the application. We do that for a couple of reasons. It's really important to us that you have the support of your supervisor in coming into this program. Kind of as Stephanie, Samir, and Lanice know, that relationship is so important, and being able to leverage them for additional coaching support, being able to take frameworks and ideas that you're learning from the fellowship experience and having their support to apply them where you're working is going to be so critical. So we ask for that reference, both so that they can get a chance to learn about the fellowship, that they're kind of they're endorsing your application for it, but also because we know that they have some of the best insights into the impact that you're having in the workplace, and also can speak to the specific areas that this fellowship can support you in developing as a professional. So that's how we incorporate them right from the beginning of the process. I will say too, we're looking for opportunities to engage more with supervisors and organizations. And so if you're part of the fellowship, we'll be in touch with your supervisor, sharing some of the same resources and materials that we're sharing with you during the fellowship, so that there's an opportunity for you to also build support for kind of new frameworks and ideas within your organization. Our website is a really great place to learn about the US fellowship. And so when you submit an application to GHC, you will identify who your supervisor is. We will send them an email to collect their reference. It's not a letter of reference, it's a few questions that we'll be asking for them to respond to. That will include links to the US Fellowship website so that they can read and learn more about it there. I would encourage you to take a look at that as well. You can share that with them, and also, talk about it in a check-in with them as you're sharing that you're interested in applying.
And John, we do have a question if you could clarify more about what the application process includes from submission to acceptance.
Great. So The application itself is a written application. We'll ask you kind of questions about who you are, where you live, what work you're doing. And then we have a few essay questions that you will submit. When you start your application, you're able to see all of these. So I encourage you to start your application now, today. You can save your application. You don't have to submit it in one sitting. It'll give you some time just to see what those questions are and kind of think about how you might want to tell your story so that you're ready for that. As Liv had mentioned before as well, we can't review your application until we have your recommendation form as well. So you can go ahead and start your application. You can submit your letter, your recommendation request. That way there's some time to get those in before our deadlines. For folks who are then going through the process, we will review the staff review your application just to ensure that there's no questions around eligibility. If we do have those questions, we'll let you know. And then our alumni, our community actually supports us in reviewing applications. One of the kind of the important things we have found is our community of leaders is best set for helping to identify who those folks coming in, who are best kind of poised to have that impact. Who is going to become part of our kind of career-long community. So they will kind of do that written analysis. We will be interviewing some folks, but not everybody. So that is because this is a new program, we're still kind of exploring exactly that final process. So you may be invited for an interview. You may not be invited for an interview. That doesn't actually necessarily mean whether or not we'll make an offer for the fellowship. We are going to have a cohort of 30 fellows for this year, for kind of this pilot year. That's the number that we're settled on. So we encourage you to get those applications in. Our priority deadline is February 24th, and then we'll review applications on a rolling basis thereafter until March 24th is the last date that we'll accept applications. Great,
thank you so much. I see about 2 more questions, and I think we have time for both of them. So I'm rooting for it. So the next question that I saw come up, and this might be a great one for our alums to answer, is what recommendations or advice might you have for someone who's thinking about pursuing this opportunity when they also have the full-time job and they're a student and managing those other priorities?
Right. Yeah, we'll pitch that to Stephania, Samir, or Lanice. How do you balance it all, right? How do you make sure that, not even balance, I love the term work-life harmony. How do you weigh that for yourself in figuring out when to kind of push into an opportunity like this?
Yeah, I think I'll be happy to take that question, since I am known to wear multiple hats, and you'll probably do the same, even if you're in just working for just one organization. You may encounter those situations where you have to take on multiple challenges or adopt many roles. So I would say the first thing is to understand how everything connects. So if a GHC and the fellowship is going to help your life's mission, right? Your vision for your future and the impact that you want to have, if that connects with everything else you're doing, then you're on to the right path, right? So it's thinking about how that connects with your mission and your values. The second thing is finding out what works for you. So for many people, it's just being very organized with your calendar and kind of taking on an operations type of focus to managing the time commitments. For other people, it's more a matter of kind of finding your passion and thinking how you want to spend your days and your weeks. So whatever works for you, just kind of trust your feelings and check in with yourself. And as Lanice was saying, also be authentic and be authentic to what you want to do.
Thank you so much. That was great. And John, I think our last question will go to you. And it was, what are some of the skills, competencies, and experiences that we're looking for in our U.S. fellows?
Great question. So we've talked about kind of some of those base eligibility requirements, right? It's age, it's where you're living and working. It's that you're kind of working in public health already in a non-clinical role. In terms of some of the leadership competencies, right? I'd say we recognize that people are on a spectrum kind of with where they are as leaders. It's not a sort of linear sort of progression. We expect that anybody coming into the fellowship has areas where they're trying to grow as a leader and areas that they're strong in and they're ready to lend those assets to the community. So our biggest ask when you're representing yourself is to be honest and be vulnerable about that, right? Shine where you shine and brag where you're able to brag, but also take some time to reflect on what are the areas that you're really trying to develop in as a leader, and be honest with us about those as well. That is the sort of, that vulnerability is so important in a leadership development program and in leaders in general. And so that is an aspect that we're looking for that's really going to make folks stand out. So that would be my invitation to you.
Thank you, John, and thank you to all of our panelists for taking the time to answer some questions and share more with us about your experiences in the program. It was great to hear all that you gained from being a part of this community, and I hope it was helpful to our attendees as well. I am going to close us out. And before we go, I want to highlight that if you know someone who could benefit from this opportunity, please consider submitting a nomination form for them so that we can get them more information about this opportunity. Nomination forms are not required to be considered or to submit an application, but it's a great way to connect people that you know in your community with this opportunity. So I'll drop that in the chat there. And if you have any questions, please don't hesitate to reach out to our team at usfellowship@ghcore.org or check out our website. You can also help us spread the word by sharing our social media posts online, wherever you scroll and Zoom and all of that fun stuff online. So thank you all so much for coming. Thank you for spending this hour with us. And please reach out if you have any questions.
Thanks, Liv. Stephanie, Samir, and Lenise, thank you so much. We will see you at the next alumni event. And to our applicants, we're excited to see your applications soon. Thank you, everybody.
Have a great day.